Do you ever find it hard to move your fingers, like they're stuck or popping when you try to bend them? These could be signs of trigger finger, a condition where fingers can get stuck in a bent position, often causing pain and discomfort. In this video, I will show you how to use pressure points to reduce or eliminate the signs and symptoms of trigger finger. And at the end of this video, I will give you an additional procedure that just might make all the difference. Trigger finger happens when the tendons in your finger get inflamed, making simple movements challenging and painful. It can affect anyone, from office workers to athletes. Recent studies suggest that acupressure may be an alternative to surgery. According to research published in the British Medical Journal, patients experience significant improvements in pain and the ability to move their fingers freely after just a few acupressure treatment sessions. The research concluded that acupuncture point stimulation may help reduce swelling, especially in early cases. In the next few minutes, I'm going to show you how to find and activate 3 key acupressure points and a special procedure for trigger finger that work together, so it's recommended that you use all of them for best results. My name is Dr. Barrett. I'm a chiropractor, nutritionist, herbalist, and I'm an expert in Western acupuncture. I've dedicated my life to helping people avoid unnecessary medications and surgery by giving them options that are both safe and effective. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos like this come out. The first acupuncture point recommended for trigger finger is located near the tip of your index finger. To find it, start at the base of your fingernail, then move to the point that's just below the corner of the nail that's on the thumb side, right over here. So if you say this is the nail and this is the base of the nail, the corner on the thumb side is right here. Push in to find a point that is sensitive, sore, tender, or painful. That is the point. Massage this point in a circular motion for 20 to 30 seconds like this. Or if you have a Tation, which is an acupressure instrument, you can pulse it 25 times like this. The next useful point for trigger finger is located near the tip of your ring finger. To find it, start at the base of your ring finger's nail, then move to a point just below the outer corner of the nail on the pinky finger side, like this. Here's the ring finger. Here's the nail right over here. You're at the base, you move to the pinky finger side, and then you find the point that's just on the outside, just below that. Push in to find a point that is sensitive, sore, tender, or painful. That is the point. Massage this point in a circular motion for 20 to 30 seconds, like this. Or if you have a Tation, you can pulse it 25 times like this. And here's another view. The next useful point for trigger finger is located near the tip of your pinky finger, again at the base of the nail towards the outside of your hand, right over here. Here's the nail and the point is right over here. Push in to find a point that is sensitive, sore, tender, or painful. That is the point. Massage this point in a circular motion for 20 to 30 seconds like this. Or if you have a tei shin, you can pulse it 25 times like this. And here's another view. Now find and massage these points on your other hand. Take a deep breath in through your nose, let it out through your mouth, and again, and one more time. Go ahead and open and close your hands a few times. Notice how they feel. The extra procedure is to locate additional tendon points near the problem joints. In Western medicine, these are called trigger points sometimes, and in Eastern medicine, they're called shi points. You can locate these points using the eraser end of a pencil or the round end of your tei shin. Let's take a look at how this might work. Let's say this is the problem joint right here. So you're going to go ahead and press in, looking for tender spots with the eraser end of your pencil or the tei shin. And let's say we found a point right over here. Then go ahead and massage that point for 20 to 30 seconds, or with your tei shin, pulse that point 25 times, just like that. Look for 2 to 4 trigger points or shi points around the problem joint. You can do this each time you repeat the procedure. The points may change, and that's fine, and it's expected. I recommend that you do all these points 3 times a day for 30 days for best results, and then use these points as needed thereafter. I'd like you to remember that it's not necessary to push very hard or to cause pain. The next step is to reduce inflammation. I've put my video, Reduce Inflammation Naturally, right over here. Check it out.